Student Mental Health and Wellness in the Office of Health and Hospital Affairs at SUNY System. As Michaela mentioned, today's session will be covering the 8 dimensions of wellness and supporting the whole student. I'm happy to introduce you to our presenters today, and I really look forward to hearing the presentation. And so our first presenter is Dr. Jeremy Blowers. He is a full professor, licensed therapist, and coordinator for wellness and intervention services at SUNY Cayuga. A 3-time SUNY graduate of Cayuga and Plattsburgh, Jeremy holds a doctorate in health psychology specializing in behavioral medicine and is a licensed New York State mental health counselor. As a behavioral health provider and professor of 27 years, his passion resides in assisting students, faculty, and staff in achieving their optimal wellness. Our next presenter is Dr. Smita Majumdar Das, the Executive Director of Behavioral Health at Stony Brook University, and oversees counseling and psychological services and the Center for Prevention and Outreach. Dr. Majumdar Das is a clinical psychologist with specialized expertise in trauma-informed care. Her leadership has been instrumental in securing over $2.1 million in federal, state, and private grants to enhance data-driven prevention strategies and promote student well-being. In addition to her administrative and clinical roles, Dr. Majumdar Das is a public voice on youth mental health, having appeared on platforms like WLIW-FM to discuss childhood anxiety and the importance of open dialogue with young adults and adolescents. And last but not least, we are joined by Christine Szaraz. She is the Associate Director in the Center for Prevention and Outreach at Stony Brook University. Ms. Szaraz is a licensed mental health counselor with almost 2 decades of experience addressing the health, wellness, and interpersonal needs of emerging adults in higher education settings. And she has been recognized for her innovative work supporting student wellness and safety. In her current role, she oversees mental health promotion and early intervention programming, as well as sexual violence prevention education and survivor advocacy services for Stony Brook. So with that, I will kick it off to Jeremy to start with the presentation today.
All right, thank you very much, Julie. And thank you, SUNY, for allowing us to do this presentation. And I want to say on behalf of myself and my wonderful colleagues that we've really worked hard to bring this presentation to you and hope you enjoy it. I hope we enjoy listening to it as much as we enjoy doing it. And I can tell you I've learned a lot from this myself, so I'm really excited to be here with all of you. We started talking about the dimensions of wellness. A lot of campuses have seen this. A lot of us have studied this in some way, during our schooling or beyond. And what we're trying to do today is to bring that framework into a little or a lot broader context than you might be used to. So if I could have this slide change here quick. Thank you. And one theme we're going to see throughout this presentation, I don't want to take any thunder away from my colleagues here because we'll be touching on this a lot. But you're probably noticing a theme like, why is everything shaped like a gear? And what we're going to be talking about today when we talk about wellness is that we see each dimension of wellness is gears fitting together. So as my colleagues and I expand on this, what I mean by that is that, when one gear or one aspect of health is stalled, then the others are invariably going to suffer from that. So our goal is to, not only give some oil to that one wheel, but also to show you how you can get all these wheels moving on your own campus. When we think of the 8 dimensions, we often kind of confine it to, wellness centers or counseling offices. And of course, that is true. But what we're hoping to do today is expand that view of wellness. So take it, from that counseling center, take it from the wellness, realm, so to speak, and get you to understand that your whole campus is the wellness realm. And to further, unpack a little bit of this, I'm going to hand it off to my colleague.
So in 1946, World Health Organization reframes health as more than just absence of illness. And that was momentous, right? It's about thriving physically, mentally, socially. And that sets the foundation for a multidimensional view of wellness and comprising of intersecting dimensions. And that's what we are excited about. Next slide.
And I'll jump in here just to talk a little bit about the 8 dimensions model. So just to kind of identify each of those dimensions that are currently in use with the model, we're talking about the dimensions of emotional wellness, environmental wellness, financial wellness, intellectual wellness, occupational wellness, physical wellness, social wellness, and spiritual wellness. And as Jeremy highlighted when we started, these dimensions are really envisioned in the wellness model that Swarbrick developed as not only being like a person-centered, strengths-oriented focus, but we're seeing these as being interrelated, overlapping, intersecting dimensions. This model has evolved since it was initially conceptualized back in the 1980s and 1990s. And initially, it only included 5 dimensions. The intellectual, the financial, and the occupational were all added a little bit later. So by 2009, we get to the model that we see now with all 8 of these dimensions. And in 2010, this model was adapted by SAMHSA, the Substance Use and Mental Health Services Administration, as a framework for addressing health from a strengths-based, whole person perspective for people in a variety of populations across the lifespan. And we can advance on this one.
As we reflect on any model, it's important to kind of know its limitation and also have a critical aspect to what we are talking about today. So as any model goes, some limitations do exist with this model. First, the framework is more conceptual than evidence-based, which limits its utility in clinical and policy settings. Then the model assumes a universal applicability that may not reflect in diverse lived experience. It often overlooks systemic barriers such as SES, access to care, that shape wellness differently for marginalized groups. And then one common critique is some of the dimensions, like spirituality, can be very loosely defined, making that very difficult to operationalize or measure. Next slide. But even with this limitation, the model offers a holistic framework for supporting student success and well-being in higher education. It encourages universities to go beyond academics to create more inclusive and responsive environments and to create a balanced and meaningful experience that lives and goes beyond the college years. Next. This model was adapted, is from the Virginia Commonwealth University Center for Society and Health, and it illustrates a powerful bidirectionality between education and health, how each influence the other and how broader life conditions shape both. The top arrow, the purple one, basically says education creates opportunity for better health. Education equips people with higher income, we know, access to resources and healthy behaviors. But in the middle arrow, if you see the light one, it flips the perspective. Poor health hinders educational success. When students aren't healthy, their ability to learn and thrive in school is compromised, and we all know that. However, both are impacted by larger contexts that we are embedded in: social policies, housing, healthcare, community support, family. So all these contexts impact both health and education. And we can't look at education or health in isolation. The context truly matters. And talking about 8 dimensions, we're talking about a lot of context we can actually work to improve our student health and well-being. Next slide. So as we established, the 8 dimensions of wellness applicability in higher education aligns with key research on student success. KU demonstrate what we all have widely accept and know now. Social engagement and sense of belonging impact success. ACHA data, American College Health Association data, has noted self-report of mental health struggles as a major barrier to academic performance, reinforcing the need for emotional and psychological support in higher education. NACE, National Association of Colleges and Employers, identifies student employment as a high-impact practice that significantly enhances student learning, engagement, retention in college, one of the occupational dimensions we're going to talk about. And we all have gone through what COVID has impacted as far as education, persistence, and learning is concerned. So one of the major health events in our lifetime, hopefully, has shown what it does to our connections. Next.
So again, when we talk about multidimensional wellness, we do often default sometimes to the counseling center. And as I said in the beginning, this is certainly true, and that all of us here who are clinicians or work with students on a regular basis in that realm understand that we need to be meeting and addressing all those elements that we talked about so far. You know, not just the psychological health, but also the physical wellness, occupational, financial. And so we do that on a daily basis. But I think sometimes what happens is we as an institution sometimes like to keep that parked there. And what we're trying to do through this presentation and through some of the dialogue we're going to have with you is to kind of expand your vision of what that could look like when it's outside of that counseling area as well. So again, inside the counseling realm, we do touch on those elements, and the question becomes, well, okay, well, how does that spell out into the rest of the campus? And it can do so in a variety of ways. A couple that we're going to be talking about, my colleague will pick up on in a minute, are things like bringing people to campus, bringing other wellness, mental health, clinicians or organizations to campus to meet with our students. And this can be done through, wellness fairs or special events. Another thing too is, we tend to confine our mental health staff, to these, realms, these wellness, corners of the campus. But I would really encourage any institution out there to lend their mental health professionals to the community as well. So as we're inviting partners in, be that institution that allows your mental health folks to go out and speak about these issues that we're talking about today to the community. Because, being a campus community means, everyone's involved in this wellness model. But to highlight some of these more specific and really exciting, I've taken notes throughout this whole time we've been planning this, by the way. So I hope you all do too. Highlight some of these as my colleague Smita to talk about some things they're doing on their campus that highlight the very things we're talking about.
So in counseling and psychological services, I really wanted to invite student voices, diverse student voices into the space, not just coming to get mental health treatment, but actually being reflected on the walls, what we put around them to see them represented. And over the last 3 years, counseling and psychological services at Stony Brook has really worked with student community artists to bring art that reflects our student on our walls. As you can see on the left, it was the first project of Mandela, where all our community partners, around 60 students, came in to fill in the colors of the Mandela, which now hangs on our stairwell right in front of our mascot, as you can see. That was one of the big projects. When students are coming in, they're seeing themselves on the wall. Now on the top right is the origami flag, the thousands of little colorful cranes that was created by our origami club. And they needed a space to host the flag after the show was over. And CAPS was like, yes, we want it here. And that is one of the biggest pop-up colors when students come in and they can see themselves and the craft they left behind. Below, you'll see a student hanging their art. So CAPS has opened their space as a kind of a gallery where we don't possess the student art. We allow the student to display their art. And when they need to take it off to show outside, we allow them to do that. We also partnered with the art department to get abandoned art. Students who could not take their art behind because they were so big or they were leaving for international locations, and they left the art which was sitting in an attic. So those art now get circulated in CAPS, and we host them with respect and care and kind of give credit to the student. So in one way, bringing the student voices in. Also, as you're coming up CAPS, we come up a stairwell and you'll see a little like our front desk. Our front desk constantly revolves all through the year on different celebrations that's happening, whether it's Diwali, whether it's Hanukkah, Christmas, Thanksgiving, Hispanic Heritage Month. Every single month, there are 2 or 3 things, which is pretty easy to do. But when the students are coming up, they see, oh my God, so that's my festival. They feel an automatic connection that you're creating beyond the counselor, but to the space itself. Next slide.
So while these examples really illustrate some beautiful and quite meaningful ways to bring this perspective, the multidimensional, or what you will see abbreviated as MDW throughout the presentation, those perspectives into the counseling center, what we really hope to do is spend the bulk of our time, the rest of our presentation, really highlighting opportunities for integrating multidimensional wellness throughout the rest of the campus ecosystem, to give folks who are not in clinical or mental health adjacent roles directly, the opportunity to see, as Jeremy highlighted before, the whole campus is our wellness space. And so that's what we'll be doing with the rest of our time. A couple of things worth highlighting, for example, is the idea of intentionality, right? This won't happen just by itself. We have to think, make connections. That collaboration piece is going to be key. And hopefully you will see some opportunities through the examples that we provide to innovate, to build on what might already be there, or to create something new. And we really approach this from the perspective of ideas that would be relevant and useful regardless of the size of your campus. Cayuga Community College, Stony Brook University, very different in terms of size, budgets, all that kind of stuff, but we're all doing some things, and you might be even surprised by how many things we're doing in similar ways. Just as one opportunity to illustrate an example of what you might be able to do, what we're doing on campus, this image that you see here illustrates a student who participated in Stony Brook's Cooking from Home program, which is a partnership with our campus dining folks, where students can provide a recipe that they made growing up, that their family made at home. And that recipe, when it's selected, is scaled up to be able to be served to the entire campus community. So it's a way to bring together that social, that cultural, that family dimension, along with the physical dimension of eating healthy. And so it's a very popular program, and it's a lot of fun. So that's just one example. But as we move into our next slide, let's focus up on some ideas for what we can do in the emotional dimension of our campus world. So just a few tips. So, kind of building awareness events, public things that are big and bold and bright for students to kind of gain awareness around those highly stigmatized topics. So for example, at Stony Brook, we have an annual walk for suicide prevention, as well as for domestic violence awareness. We have a drug take back day, topics that are not so easy to talk about, and students might not always present themselves eagerly to discuss. We can kind of insert and incorporate those activities in other parts of student life, campus life, to kind of take some of the stigma out. Using peer educators, right? We know that students typically are more open to hearing about some of these challenging topics from their peers as opposed to their professionals or people who look like their parents or grandparents, right? Creating spaces, sensory spaces, relaxation spaces, events, even if we don't have a full space to dedicate towards relaxation, holding relaxation events, mindful meditation activities. These are all ways that we can reinforce that as an institution, we believe in these activities and that they're important for students to think about. When we're thinking about the faculty side of things, how faculty can support students' emotional wellness, well, first of all, making it clear, statements in the syllabus, and the faculty engaging. How are you? Is there anything you need to talk about? Encouraging students to participate in office hours, or even creating lower stakes collaborative assignments so that the focus isn't purely on the grade. We know that many of our students, especially the high achieving ones, they really sort of come to equate their identity with their grades. So being able to kind of help them break out of that can be great for their emotional wellness. And building skill building workshops around emotional regulation. So managing stress, managing anxiety, coping skills, sleep, nutrition. These are all great ways to help students build the skills they need to stay well, not just now in college, but beyond that. As we look at some of the examples that we have both here at Stony Brook and at Cayuga, well, one of our most popular programs is our pet therapy programs. So you'll see a mix of pictures from both campuses showing students relaxing with trained therapy animals, mostly their dogs, but occasionally we've had a pig in the mix. And these are really great ways for students not only to kind of relax and de-stress, there's a lot of evidence about the benefits of animal-assisted interactions, but it's also a way for them to come together and make connections with each other, as well as with, professionals and resources, like the offices we all operate. When we look at another side of the example on our next slide, We can also see those opportunities to create those relaxation, the meditation, and the sensory spaces create a lot of opportunity for students to really just step outside of their stressful day and just take a minute to themselves. Here at Stony Brook, we have multiple campus locations, and you can find these kinds of spaces, these kinds of opportunities in every space. And at Cayuga, there's also dedicated spaces, and you can see some folks sitting in like those massage chairs. So whether you've got a little space to work with or like tremendous amounts of space, I don't think anybody has tremendous amounts of space, but whatever you've got to work with, these are ideas that folks can build on. This also highlights kind of the overlap between the emotional and the environmental. And as we look at some of the strategies on our next slide for kind of addressing environmental wellness for our students, well, it starts with some of the things we've already talked about, right? Creating that welcoming and accessible space, whether we're talking about counseling centers, residence halls, service centers, other common spaces on campus. Whether that is using literally green plants to create that, or the kinds of messaging that we've already been talking about, culturally sensitive and welcoming messaging. We can also think about more specifically sustainability initiatives, right? Like campus recycling, composting, community gardens. Just having access to green spaces. And this is where I'm a little jealous of Cayuga, because it seems like where you're located, you've got lots of green space, lots of nature trails that are sort of part of your campus life. So amazing. But even when we're not talking about the environment out there, helping students think about the environments they're operating in, their rooms, their dorms, whatever it might be, helping them learn like tips and strategies for organizing their own personal spaces. And also as institutions being responsive when we're hearing from students that their environmental spaces aren't ideal, that they're looking for more. Just to put a couple of examples to that on our next slide before I hand it over to my colleagues, I want to just give you some examples of gardening initiatives here at Stony Brook University. So that first big picture, that is something that you will find at our Health Science Center. It is part of the hospital. So the things that are growing there are going to be served to patients. We also have a couple of other community gardens. And by the same token, students are not only able to kind of get their hands dirty, be out in nature, and enjoy kind of that dimension of their lives and the campus environment, but then they're able to give back. So that picture at the top is vegetables that were being grown in our community garden being donated to Stony Brook's food pantry. So supporting student needs in multiple ways through these initiatives. Again, you can see the overlap here between these different dimensions. It's not limited to just the environment. Once we start working on it, it goes broader.
Thank you. And that was, so you can start to see that these things that we're talking about, one of the stopping points sometimes I think for campuses is that they look at some of these initiatives and think, or, you know, I really want to do some more wellness things in campus, whether it's intellectual or anything else. And then, but it's going to cost money. It's going to cost a lot of money and a lot of time. And what we're trying to repeatedly, you know, kind of bring up to everyone here is that these things don't have to cost money. There are partners out in the community that are willing and wanting to help. You know, you can create some really beneficial and mutually, you know, positive relationships there as well. One thing, there are a couple things that I wanted to kind of tag along on with that, that we do here at Cayuga that we're really excited about. And it came about when my memory was jogged when we were talking about the art. So here in the Wellness Center, what we've been doing is having a revolving art gallery where students and our art program every semester will come down and get to display their art, not only on the walls, but to their fellow students and explain, you know, what the art means and, you know, take questions and have discussions. And so that really, again, all overlaps with the emotional and the intellectual. You know, our students are learning as well as teaching. And those nature trails, by the way, Chris, I wanted to tell you that just before we did this presentation, our NAMI chapter here on campus decided that they wanted to go out because, as everyone knows, this month is very important, you know, for mental health. And so they went out and put out positive signs over the nature center. I tried to get a picture for it today, just couldn't do it. But again, it was virtually free because the art department heard we were doing it. and donated the materials along with NAMI, and our students and our folks did that. So another example of how, you know, that overlaps. As far as intellectual goes, yes, we're talking about teaching independent research and activities. We want to really foster that sense of curiosity and lifelong learning in our students. We really want to be, and I know as a professor, sometimes we are flexible grading, sometimes like, oh, I don't know. What that means is basically, you know, we really treat every student as the human being that they are. And we know as humans that things come up sometimes that we might need to, you know, look at our policies and how we grade and how we do things, and, you know, make some room for students to not only heal, but also to grow too. And that compassion really matters. Get panels, roundtables, anything where you could bring someone to campus to learn something new. I always tell students here that, you know, are you thinking about going to that presentation today? Well, I'm not sure because I really don't know what it is. It kind of freaks me out or scares me a little bit. Then I'm like, go. And it only scares them because they just don't know. And they come back, oh, it's amazing. I think that I want to take this class next semester because they saw that. You know, peer education is really important, student leadership opportunities. And before I hand it over, I do want to tell a quick story that kind of overlaps things a little bit. And I told this to my colleagues when we were, you know, building this, but I think it adds a lot of relevance here. So the story goes, I had a student who was in the wellness center. We were talking, and she, you know, we had talked a lot before. And she came in the pantry and said, I'm really having a problem, but I don't think it's a problem that you can help me solve. And I said, what's going on? And she said, well, something happened with my financial aid. I don't know if there's a glitch, but, you know, I'm getting this outstanding bill, and I know I did everything right, and I just don't know what to do. I'm kind of thinking that maybe school is not for me. So it just so happened that one of our financial aid folks who donates to the pantry often was there. So I went over and I said, hey, I have a student who has a financial aid question. Could they make an appointment with you, or could I do a warm handoff to let them, you know, work with you a little bit and figure this out? And the staff member said, why don't they come over and sit with me and have some coffee? So they sat together, and in a matter of 10 minutes, that student's issues were solved. Other students saw that this, you know, staff member was there. So that sense of belonging, like, wow, these people really care about me here, you know, to come down and donate here or to sit with students. But what that student didn't know at the time, she said that, you know, employee, she's really nice. You know, who was she again? I said, that was your director of financial aid. And that means a lot, you know, to not only her, but other students who are in the vicinity. So, you know, always an opportunity to teach and learn. Again, the peer education and student leadership opportunities are very important. There are programs like 4-credit programs, year-long programs that are available for students who want to get that kind of experience. And it's not, again, it's not something that we have to recreate the wheel, that we have the resources and folks on campus to do that. It's just the intentionality, as my colleague Chris says.
Jeremy, I'll jump in and just talk a little bit about the program we have here at Stony Brook, if that works for you.
Thank you.
Yeah, no problem at all. So peer education has really been a core part of our health and wellness programming at Stony Brook for many years now. We've been recognized at both the regional and the national level for our peer education programming. And going back to Jeremy's point, it didn't start big, right? It started small. It started with students doing independent study, you know, maybe honors projects. And gradually over time, as, you know, we were able to resources it, sometimes through, you know, allocations, sometimes through grant funding, we were able to grow the program to what it is now, which is a full year academic credit bearing internship program where students are involved in all forms of prevention and outreach work around mental health and wellness, suicide prevention, sexual violence prevention and survivor support, alcohol and other drug awareness, and physical health issues. So we have bystander training programs for each of these. Our students support all of our programming. And again, it's a great way to kind of connect with students in a way that they are sort of open to hearing about some of these topics and to support that intellectual and occupational development of the students who are in the peer education program, which I think is a great segue to Smita talking a little bit about the occupational stuff. One thing that I think is worth noting is we sort of have built like a you know, a self-sustaining system, because as our students complete the internship, we've invested a significant amount of them. They've invested a significant amount of us. and they stay on as paid student assistants. And this is how we're able to do a tremendous amount of work with a relatively small staff.
Thank you, Chris. And that's very real. Most students who are coming to college are looking to find their career, find their passion, find what they're going to do after college. And occupational wellness is so strongly connected with emotional wellness, social wellness, that it has been stated as a high impact practice to kind of give student exposure to different learning opportunities, networking opportunities, skill building opportunities, job shadowing, mentorship, internship, because we have seen that those connect the students best to finding their passion, really figuring out how to solve real world problems, and also exposes them to diverse career opportunities. They might come in Stony Brook, we see that. They come in as pre-med, and then in 4 years, they have found their passion. Now they're doing something entirely different, and they're happy about it, that they met that particular pharmacist or met that particular social worker, and they really got influenced by that person to really explore what is there. So at Stony Brook Career Center absolutely takes the charge for career related activities, but we all partner, we all come together, whether it's student health wellness, whether it's student engagement activities, because these all spaces provide those opportunities for students to connect. As you can see, Alternate Spring Break is a huge program in Stony Brook, and they take students to different locations in the United States to do service projects and kind of build community and learn about things, right? So internship fairs are massive, career fairs are massive at Stony Brook. Next slide. There's some pictures that we can talk about also. So these are in Cayuga as well as Stony Brook, multiple different health professional panels that really exposes students to their passions and also sees diverse health professionals from different backgrounds kind of talking about their experience and their journey. Because I remember in Stony Brook, we had one of the alum who's now a psychiatrist join us for a suicide prevention walk. And he talked to our students about his struggles, his academic struggles as a student in Stony Brook, and how he found his way and passion to go into medicine. And now he's a psychiatrist. And just listening to that person in a room full of students, you could see the students light up, because that gave them hope. Like, if this person who's a psychiatrist is talking to us today, is talking about his personal academic challenges and social challenges, which means I have hope. And connecting alumni who have struggled and who come back to your campus is a massive part of our career center in all our places. As you can see, the bottom left picture is student health services. We do a career center, we collaborate with a career center to offer a panel about different health professionals who work within our building. We are PAs, MDs, psychologists, social workers coming together and talking about a journey. So our freshman students or students who are starting in our campus can hear from us and kind of start seeing how those pathways reflect. So again, occupation, really important, builds communication skill, leadership skills, and navigating future opportunities, because that's all. Sometimes the college is really important to students, is the occupational, what I'm going to do. And we can come together and really give them those exposures. Next slide.
And so as we think about the social, you can hear in what my colleagues are talking about with regards to these other dimensions, the sharing of those personal experiences, the making of the personal connection, whether it's the student to the student or the professional to the student, bringing in that social side, that sort of connection supports what they're doing on the occupational side, but it's also supporting their social wellness, right? Being connected to other people, it's integral, right, for humans to survive. Social connection is as important as breathing, as air, as water for all of us. Not to go off on a tangent, but the U.S. Surgeon General is, declared an epidemic of loneliness in our country and beyond. So thinking about how we can kind of reinforce those social connections for students is really super important. And so some of the stuff we've already talked about applies here as well. So that kind of peer engagement, peer support, mentoring activities, supporting students in supporting each other is really useful and important. Being able to kind of help folks kind of celebrate their own identity, however they identify, whether that is through their gender identity, their cultural identity, whatever it might be, celebrating and showing that we celebrate that through various kinds of campus activities. Being able to support people, as Smita mentioned with like the occupational side, so important to build those communication skills. We can support that on the social side by offering workshops on communication in different kinds of settings. So for example, navigating differences in a work environment, or navigating conflict in a relationship, social or romantic, right? I mentioned bystander intervention training, so helping students learn the skills they will need to look out for each other, not just on campus, but again, through their lives outside of the college community as they advance in their life. And creating dedicated spaces for populations like commuters who can feel like maybe they're left out sometimes, depending on the kind of vibe or the nature of your own campus. So creating these dedicated spaces can be really powerful. And as we look at the next slide, the idea of having dedicated spaces comes through here with our global community program. Not so much in the sense of there's one space that is dedicated just to this program, but thinking about holding space for students who identify as global students, not just international students, but students for whom their cultural identity plays a central part. Being able to partner, for example, with our global affairs here at Stony Brook. We hold these sessions typically in the International Student Lounge, a space that has been dedicated to international students, but also opens that space up for more folks. And you'll see some overlap with other collaborations. Like I mentioned, that cooking from home program. The picture in the center is a little spice map where we ask students, say, where does your flavor live? Wherever you live, maybe the flavors that make you excited live somewhere else. And it's just a way to reinforce the connections between all of us. And if we go on to the next slide and think a little bit about kind of the way some of these things overlap with the physical dimension, right? Again, having spaces where students can go to take care of their physical health as well as their emotional health. Having accessible services, right? So if our student health center is essentially a student has to, run the gauntlet to get in there, not accessible, not going to be so convenient. Or even thinking about accessibility in the sense of the physical activities offered throughout the recreation setting. So if we're doing wellness walks, is it a pathway that anybody could use? If somebody goes to the fitness center, is there equipment that they're able to use, right? So thinking about ability and accessibility for all students, providing support with nutrition for all students, and thinking about especially students who maybe are dealing with food insecurity and their unique nutrition needs. Being able to provide free or low cost activities as well as health products. This could be, preventative care like doing flu shots, or it could be little health kits, and providing education around these topics. For example, we mentioned sleep before, offering sleep hygiene workshops. This is something all of us could probably relate to, but our students are often struggling with sleep. I'm just seeing popping up in the chat, pizza. I love the idea of pizza. And whether that's a end in itself or a means to get people to attend some of these other stuff, that just caught my eye. Just thought I would comment on it. And if we go on to our next slide, just want to put a spotlight on the free health products program that we have here at Stony Brook. So we have two different ways for students to get free health products. Through the Center for Prevention and Outreach, where our students are creating lots of different kits, safer sex kit, menstrual hygiene kits. You will see the picture there in the center on the bottom is a cold and flu kit, first aid kits. Sometimes you just need a Band-Aid. You don't need a big medical appointment, but where are you going to get that Band-Aid, right? And while our area can't give out medication, like if you have a cold, I can give you tissues and honey and tea. Our friends in student health also have a free self-care clinic where students can get over-the-counter medications without needing an appointment. So when you put it together, it's a great sort of set of resources where students can really take care of themselves in a lot of different ways. And these services are provided partly through like funding through student health fees, but also through partnerships in the community, right? So bringing CVS to campus to provide those flu shots, or working with community partners to take in donations, say, of sunscreen or what have you. So again, there's different ways to approach this depending on your campus resources and the relationships you build with your community.
When we talk about the spiritual elements, one thing that automatically comes to a lot of folks' minds is religion. And of course, that can play an integral role in someone's spiritual practice. But I think what we're talking about here is defining spirituality in a broader context. And what I mean by that is I like to keep things simple. So when students ask me and we talk about spirituality, we define it as just something bigger than you are. And that can encompass a lot of things we talked about already, and probably a lot of things we can talk about, to come. But as far as this goes to that loneliness part sometimes, because I find a lot of students who might be here, even as commuters, and say, well, I'm out of my community now. I really don't have someone I can talk to about my faith, or I'm trying to find my purpose here, not only as a student, but as a human being, and how can you help me? And we used to actually have chaplains here on our campus many eons ago. We don't have that anymore. So when that came up more and more, we decided to start, looking around, and through some of our other events, came in contact with some local faith providers who are more than happy to accommodate us. And then what I mean by that is, I was trying to, well, I can probably get some money together to pay you a small fee, to come to campus. And none of the faith leaders wanted that. They were more than willing to help the campus and more than willing to help our students. So I kind of half joke about this, but it's true. I have a pastor on call here who says, any student who needs me anytime, here's my personal number, give the number to them, and I'll meet with them on or off campus. And those kind of small partnerships can make a big difference in a student's life here. So again, we're not looking always to something, that costs money, or some, huge project that takes years to develop. It could be as simple as, making some phone calls, or, visiting some local organizations, or asking students what they want, which is the number one reason why we're here. And trying to, take that information and deliver on that. There are some interfaith organizations on campuses which can be very helpful. Whenever they're on campus, or whenever we have one, I've always tried to invite them to every event that I've had across my 27 years, because I find that they bring a lot to that event. And also some students who just might be looking and know where to look, can look those students up. And again, it's not me telling the students, or me giving students information so much on their spiritual practice, their faith, but it's other students who are actually explaining what the club does and what they do. There's also some bigger events that happen on campus, and one that I'm really excited about. And I'll get to that in a minute. But so we make sure I cover everything: the interfaith organizations, collaboration with campus ministry, also seminars, panels, and other activities. And what that can look like, by the way, and is really exciting, is I'm trying to bring this to our campus now, because I attended it somewhere else, where they brought together leaders of all different faiths to sit down for students and faculty and staff to be able to talk a little bit about their faith, and to allow people to ask questions. And I think right now, it's always important, but I think right now that's probably as important as ever. And again, none of these folks have asked for money. They want to come to your campus, and they want to be a part of it. So reach out to those folks. Next slide, please. I just say this because as we were doing this presentation, I'm always trying to think of ways that we can, here at Cayuga, can really highlight spirituality and celebrate our students' diversity. And I thought this was probably one of the greatest things I've ever seen. This is just me personally talking as a panelist, but honestly, to all you folks out there, the Festival of Lights that Stony Brook has, I loved it so much when we were talking about it that I actually want to attend this at some point. So, but it's a campus tradition, so students look forward to it. And again, it really highlights the diversity among our students, but also at the same time brings together students, faculty, and staff too. And that's what spirituality is all about. And of course, you bring in song, dance, and food And, you know, what more could you ask for on that? But it's a wonderful experience, and I really want to experience it myself. Again, something that all campuses can do.
Also, Jeremy, just wanted to add, like our Interfaith Center hosts Interfaith Thanksgiving, which is a beautiful event around this time for all people of all faith. And also CAPS and CPO has worked with our Interfaith Center to kind of build that bridge between spirituality and mental health, because they see a lot of students who are in mental health crisis. And how do you kind of build the bridge so they can cross-refer to us without any stigma, and they know each other? So we have built this relationship for almost 10-15 years, going to their presentation, going to Interfaith Center. So these are all dependent on slow relationship buildings.
Thank you.
Next slide. And it brings to the financial part. We all can attest that it can be a major stressor for us, for our students, and how can we support them through these stress, right? One part what we have heard from students, not understanding finances, not understanding loans, not understanding health insurance. Just the education around how to manage finances can go a long way. And our Office of Financial Aid and College Scholarship Services provide a lot of financial literacy workshop for our students to really just getting into the nuts and bolts about how to manage money and use money. On the other end, we also know at different points of our life where finances can become a challenge, like we have a flat tire, or the laptop is not working, or I need to get to my doctor's appointment, but I don't have the money for the Uber or the train ticket that I need to go, or maybe I need 2 meal points because I'm running out of meal points. So at Stony Brook, we have created a student support team does amazing work to have created this emergency funds for students to really access small amount of money to kind of really help and tide over whatever crisis they have. Similarly, we have a mental health fund, which students who are eligible can get their co-pays paid out or a small part of the payment for getting the testing done. Those are amazing benefits to have. Or their laptop is not working, so getting a laptop loan works out for the students, right? Also, partnership with our local credit unions. We have a partnership with Stop and Shop. That Stop and Shop donates $10,000 to our food pantry, as well as giving groceries out to our students who needs those money, right? Work study program, campus employment. These are really, really strong indicators for student success, because if students feel like they're financially floating, they can then focus on the other aspects of life. When your finances are not there, it's really, really hard to focus, as we all know. Next slide. These are some of like Money Smart Seawolves is a really big program at Stony Brook, and they really work with our students to help them understand budgeting, how to understand loans, and all these aspects that keeps you financially healthy, because we truly understand financial health. It has a really strong connected to all aspects of your wellness dimensions. Next slide.
So as we're wrapping up, our goal was today to give you a little bit of a buffet, right, of different ideas that you might be able to use, or that might get you thinking about other things that might be creative, innovative, collaborative on your own campuses. So we wanted to end with a little bit of a guidance around action planning. How can you apply the 8 dimensions model, or more broadly, the multidimensional wellness model, even if you're not able to get all 8 dimensions at once, but how can you approach this on your own campus? And just to kind of run through these before we wrap up, first of all, defining what multidimensional wellness means for your own campus, right? The idea of what are the ones that you want to focus on? Where are maybe you're already feeling shored up around maybe the mental health, the emotional side, but the environmental side needs some work. So thinking about where you want to focus and how you want to kind of identify that multidimensional wellness landscape. And then part of that is assessing what's already there. What do you already have to work with? Who might you be able to collaborate with? Where are maybe their partnerships that are just, bursting, ready to go if you just put the right people together, right? From there, thinking about broad goals and specific objectives. Let's say the broad goal is we want to have our own relaxation room in this particular building. That's going to be a multi-year plan. So maybe a specific starting place is just getting all those people at the table to talk about what that might look like. and connecting with potential partners. None of us can do these things alone. Again, this idea of these dimensions overlapping and complementing each other, well, so do the people who work around these dimensions. We need to be working together, complementing each other's efforts so that we can put together these sorts of initiatives to really address the student as the whole person. So coming out of that sort of collaborative approach, developing the strategies, the interventions, the initiatives that you want to kind of experiment with and get off the ground. And once you're implementing, tracking those efforts to be able to demonstrate that there is a need, a want, a demand for this, which can often contribute to the resource allocation. And of course, assessing and evaluating for something as simple as, say, a mindfulness meditation program, getting student feedback. How did you feel when you came in? How did you feel when you left? Can demonstrate that this is an effective program that it's worth supporting or even expanding on. So, friends, as we wrap up, as we go into our final slide, we wanted to provide you all with our contact information. Please don't hesitate to reach out. If you don't mind advancing, Julie, to that last slide. You will see, and it's my understanding we'll be providing these slides to everybody. You'll be getting a PDF of the slides sent out to you all. So you'll have this contact information. Please feel free to reach out to any of us. We'd love to hear from you. We always love brainstorming ideas. Jeremy, I will definitely be letting you know when we have the Festival of Lights scheduled, so we can invite you to come on down and check it out.
And I'm just going to interject 1 minute because I'm following the chat and people asking, how do you bring people to different things, right? I just want to highlight one program that Stony Brook has done called the Bystander Program that many of our campuses have. We have 4 bystander programs, and we've been brainstorming this for 10 years right now. And at this point of time, I would say we have found the right recipe. So if our students go through all 4 programs, then they're invited to a upstander gala at the end of their 4 years and get a card. At this point, Chris can assert the numbers because she keeps the numbers more better. We have had over this year, like within the 1.5 months, we have over 800, 900 students who have already taken the different bystander programs. And at the end of the gala, we started out with 50 students. Now we have over 600 students who attend the gala and have gone through all 4 bystander programs. So it's just finding and retooling what students like. And it didn't come overnight. It started 10 years. Every year we retooled it a little bit to figure out how to get students there. So
And
just wanted to share that, Chris.
I love that you shared that. And I can't emphasize what Smita is saying enough, like that idea of slow and steady. We are constantly seeing seeds that we planted half a decade or a decade ago coming to fruition. And certainly if you're looking for a quick turnaround, that could be frustrating. But those of us working in the state probably are already acclimated to the maybe slower pace, and that is still success. And so to the point Smita was making around the bystander trainings, finding the right incentive. Maybe that'll be the pizza we talked about before. In this case, it was giving that special recognition, having the opportunity to get a cord for graduation made all the difference. Students are really vying to get that recognition. And so whatever initiative you're looking to get off the ground, having that buy-in from the students to gain more insight into what will motivate them and their peers to participate is also going to be really important. So when you're thinking about the partners who you want to collaborate with, don't forget to include the students in that as well.
Sometimes it's even the wording. If I could just throw this in there quickly too. When we talk about mental health, one question I get asked about a lot is how come so many athletes come to see you? We can't get athletes to come see us on campus because the stigma around the mental health part. So what I discovered by kind of accident years ago was that if I started naming something different, so I'd say, well, you know, I only have a few behavioral or a few performance enhancement slots available on my calendar. So, and the word spread, and it's counseling, but for an athlete, they don't want that stigma around mental health. So, and I say, well, it's performance enhancement, right? If your mental health's better, you're better. And it went from having no students to now I get probably 3 athletes a week. So sometimes just the way you invite students to it in the wording is important.
So it looks like we have a couple of minutes. I'm not sure if there were any questions that folks had that maybe we could tackle before we wrap up. Julie, we'll turn it back over to you if there's anything you want to address either from the chat.
Yeah, I'm looking through the chat. I think the main discussion was how to get students to events, which you all answered wonderfully. I'm seeing someone mentioned reaching out to faculty teaching courses related to programs, and if they're interested, providing program during the class time. So that's of course another strategy.
We've seen that be very useful, that particular strategy. Sorry to jump in on you, Julie, but with our skill building workshops. So for example, we have a number of what we call mini series. They're 3-session workshop series. Students are not required to attend all 3, but we encourage it. So around managing anxiety, sleep hygiene, coping and resilience, a couple of different topics. And we put the word out through our first year programs and just to faculty in general, as well as advisors. And often when students are coming for these workshops, they're saying, oh, my writing professor, for example, with the communication workshop, my writing professor recommended this, or my boss at my job suggested I do this. So those kinds of partnerships and leveraging the faculty influence on students can also be a great way to generate that participation.
I did see that too. I saw somewhere that someone asked about the someone putting the projects in the syllabus that are helpful. I taught a human development class, so that class had a large array of students from different disciplines that were required to take that course. And I started doing an end project where I asked them to develop like a adolescent center or a daycare center, because I knew I had some folks in there that were nurses, some folks that were childcare, had some folks that were accounting, advertising. And what I had them do is from their own discipline, they had to come up with a plan for the group and make a proposal about how that would look from their lens. So it was an experiment first. So it went really well. So the accounting person took right over and said, we need to have capital and money. I'm going to devise a plan to do that. Advertising person said, I'm going to use my skills here and chime in on my paragraph and tell how we're going to do that. And that kind of built on all these different dimensions too. I mean, I would love to tell you that that was the intention from the get-go, that I knew about the 8 dimensions and I was going to implement that, but little things like that. And they really seemed to enjoy it. So I did that for the next 15 years after doing that, and it worked really, really well.
So I see one final question that we can address and then wrap things up. Question is, I'm seeing students stressed about the job market, especially the computer science students. Thoughts on how else we might help ease their stress or anxiety?
Well, I'll jump in just to get the ball rolling, although I'm sure my colleagues have some additional thoughts. I think one thing we want to do is validate those concerns. And that might be where you're all already at, but I think a natural inclination when we see a student who is stressed out and overwhelmed is to say something to the effect of, it'll be all right. We don't know if it'll be all right. We want it to be all right. We want to support them in doing everything they can to make sure it's all right. But being real about, yeah, it is challenging out there. But also then encouraging them to connect with the resources and the folks that can really help them sort of distinguish themselves in the job market, talking about opportunities to kind of expand their skill set. So if they're really only focusing on, say, the programming side of their job preparation, there are other things they can be doing. So just as a starting place, I think validating student concerns, but then also helping them think bigger about how they can be most prepared to navigate that really challenging landscape that we all have to agree is out there.
Yeah, I don't think I can add anything to that. That validating is definitely important. And then to get them to see the bigger picture, in every industry, things have changed. And, along with that change, that we have to think about how we tackle those problems. So just because AI is creating solutions right now to things, and I think that's a big concern for people, like it's going to take my job away, or it's going to take my skill set that I've worked so hard. Now AI can do that. To help them start thinking like my colleague said, with people that really know about this. Well, okay, well, yeah, this is going to be a part that AI is going to accomplish, but these problems are going to be created by AI. So I want you to focus on those skill sets that are going to address that issue. So to get them to start thinking and in a different way sometimes is really helpful.
All right, so we're at time. Thank you so much to our presenters, Dr. Blowers, Dr. Majumdar Das, and Christine Szaraz. I hope everyone enjoyed today's presentation. I'm going to drop a link in the chat as we are hosting a few other webinars based on frameworks of wellness. So please feel free to check out that link, register for other sessions. The slides will be sent out and from this presentation. And as Christine shared, feel free to reach out to our presenters today to keep the conversation going. And also thank you to SUNY Center for Professional Development for assisting with all the technological needs today. Thank you, everyone. Be well.
Thank
Thank
you.
you, everybody.
Bye-bye.
Thanks, folks. Take